My stepson is 12 years old, nonverbal, autistic, severely developmentally delayed. So he's 12, but he's really more like 3. Will never be on his own. We know that. Like, he will need help the rest of his life. And, it's so hard on my husband. And I can't even imagine how hard it is on his mom because she doesn't have a normal mom life. Like, she's not going to soccer games and parties or anything like that. When I look at her, I see hypothyroidism. She had 2 miscarriages. The doctors told her everything is fine. Just go ahead and try again. And it's like, if maybe women take a little bit more time, and this is what I tell my audience as well, you can take another 6 months to prime your body and work with somebody who knows what they're doing with the thyroid. Make sure that your thyroid is optimized before you conceive, because that 6-month waiting time of doing some work, investing in yourself, getting your thyroid optimized could mean 40 years of you taking care of another human being. Could you wait 6 months? So that is my message to women too, in regards to the thyroid and pregnancy.
Well, as you're talking, I'm just thinking about me. I had PCOS. Now, I had always had high blood sugar. This is another thing that I found out about myself. I did a DNA test that said, Sara, you do better on a high protein, high carb diet, low fat. And I've always intuitively not wanted to eat fat. It never felt good to me. Well, high fat diet can make me insulin resistant. And here people are stopping the carbs,
Right.
thinking that that is the cause of insulin resistance. And insulin resistance can come from your fat cells being overstuffed with all these toxins we're talking about, or just too much fat.
Right.
And that can cause the insulin resistance, which can be connected to PCOS, which can be connected to infertility. So as I'm thinking back to my past, but what did the doctor give me? Clomid.
Yep.
I
Yep.
am super blessed that all 3 of my kids are healthy. Like, looking back on it, I'm like, oh my gosh, I should be taken away for what I did to my son. He was my firstborn. You know, I had the microwavable corn dogs. I had I was microwaving breast milk. So when I say that, people, I want you to know that regardless of where you're starting on your health journey, there is hope, because I started at the rock bottom. And I always tell my son, thank you for digging yourself out of my hole that I dug for you. But with the fertility part too, you're also talking about the cognition, as you're talking about your stepson, where they're connecting the dots. Even the government is, with fluoridated water is causing low IQ in children. Well, why is it such an issue now? Because we're iodine deficient. Iodine deficiency is the number one cause of thyroid issues, right? So the iodine's going down, fluoride exposure is going up, not just in the water and the toothpaste, but in the PFAs and all of the forever chemicals and all of these fluoride-based medications. It's everywhere. And then you've got the bromide and all of the other toxins. So it is affecting the cognition at the younger age, lower IQ, but then it's also connected to Parkinson's later in life. And so we know that these toxins, and iodine being the positive and the toxins the negative, are affecting cognition. Well, it all links back to the thyroid, right? So we've got a society full of anxiety and depression. Am I missing anything else when it comes to cognition and thyroid?
Yeah, no, you're nailing it. Anxiety, depression, mood changes. I've had patients say, I think I'm getting early Alzheimer's. Like, no, it's just your thyroid. Because I think the reason why we're finding that connection now with Parkinson's disease that you mentioned earlier, Parkinson's and T3, which you'll have to send me that paper, and you'll have to send me the fluoride dropping IQs because I need to send that to my stepson's mom because she still uses fluoride toothpaste, and I'm sure get some fluoride treatments at the dentist.
Yeah.
So that's a whole nother story. But
Yeah.
because there are so many receptor sites on the brain for T3, there are receptor sites on the heart for T3. So going back to the brain, we're also seeing T3 being used to treat bipolar disorder. Where, I mean, anyone that knows bipolar disorder, there are very few medications that can control that swing from mania to depression.
Hmm.
And half the time they just wipe people out. I mean, they just take you down. I
Yeah.
had a friend that had bipolar and I saw him struggle with these different meds that would make him want to sleep all the time. So instead of using these heavy duty antipsychotics or lithium that will actually cause a thyroid problem, why don't we use T3? And some functional psychiatrists are starting to do that and finding that it is a beautiful treatment for a variety of different neurological conditions.
Yeah. You would, you think about having a sluggish thyroid and all of the symptoms we've talked about. You're gaining weight, you're holding water, your hair's falling out, you have no energy to go to the gym, let alone try to build muscle and look good. So you're going to be depressed, right? Because you don't
Yeah.
even know, there's no out. There's no, I have the flu, I'm going to feel better in 3 days. You don't know when you're going to get out of this hypothyroid state. So you get depressed, which then it's a vicious cycle because then you're stressed over it, which is going to cause the reverse T3 to increase even more. And then what do you also do? You stop eating as much as you were just eating 1,000 calories. Now you lowered it to 800. And now your body's in starvation mode. And so there's this downward spiral. And those less calories and the more working out is not going to boost your thyroid health.